Okay, I guess the show is on the road. You're very welcome here today. I hope you've had your stimulant of choice outside to keep you warm, number one, and alert, number two. So my name is Geraldine Farley. I'm a developmental behavioral pediatrician. I'm a clinical associate professor, joint appointment in psychiatry and pediatrics at the Alberta Children's at the University of Calgary. I've been dealing with ADHD for way longer than it became trendy. Nobody wanted to see us or hear us, so I was usually giving parent talks for many, many years before moving on to also to postgraduate clinicians, etc. So I know that there's going to be a lot of overlap. So those of you who have attended maybe Heidi's talk on emotional dysregulation, some of you have probably attended Peggy Corkham's talk on skills in the classroom, so there might be a little bit of overlap. I would just like a show of hands, though, on how many parents we have in the audience. Quite a few, okay. How many psychologists? Okay. How many physicians, family docs? Oh, great. And pediatricians? And any psychiatrists? No. Okay. Who have I left out? OT, teachers, and social workers. Oh, excellent. Great. And nurses. How could I forget that? I worked so closely with one. I couldn't survive without that. Okay, so I just think we're all a team, and kind of that's really my focus. All right. Now, my weakness is technology, I'll have to tell you. That's the one thing I panic about a little bit. So my slides hopefully will go well. I have great support from Jackie up there. He's been amazing. Helping everybody out. So ADHD is one of the most validated diagnoses there is in the history of medicine. And that runs through the themes from the American Pediatric Society, psychiatry, psychology, etc. It's not a myth or a fad. It's with you 24 hours a day, 7 days a week. It doesn't pack up and go away at the weekend. So I think we need to keep that in mind as we listen to some of the professionals who say it's a school issue, etc. As we know, some of the kids can cope better, maybe in a very structured situation such as school, but they have way more difficulties in unstructured situations. The same with adults, work versus the unstructured situations. So, as we know, there's really no special test. How many of you have heard people going to say, we're going to be tested for ADHD? Anyway, I hear it, so-and-so was tested, but there's no such thing. It's really gathering all the evidence. When I talk here about the DSM-4 being the gold standard, we've now moved on in the last few years to the DSM-5. And the difference is that they have added a couple of different criteria, which actually makes it more user-friendly in that they changed the age, thankfully, from having to have symptoms before the age of 7. A lot of people couldn't even remember hardly to the age of 12, never mind 7, particularly with their adults giving, even the parents of the two kids, they get them mixed up. If you're 17 and older, you do not have to have as many core symptoms of ADHD as in if you're younger. However, again, it's always clinical judgment. Before, we were not allowed to diagnose ADHD and autism spectrum, which of course we totally ignored as clinicians because we could see it. And it was very obvious, and when you treated the ADHD in this population, it really made a huge difference in their lives as well. They were able to socially be more appropriate, stop and think, use some of the strategies, etc. And we like the addition of some adult samples. They were all just geared to little boys, who were in elementary school. That's what a lot of the examples were from the DSM-4. So with DSM-5, they talk about your cell phones, your glasses. They've sort of generalized it. I might say this a few times, that it's really important to know, whatever your treatment and management is, that ADHD individuals function best in a consistent, structured, predictable environment where everything is clear for them from the get-go, and there's no confusion and no arguing about what it is they're supposed to do, whether they're adults with a spouse or a parent with a child, teachers, etc. So best practice really in looking at in clinical practice and in research is to combine both psychosocial and psychopharmacological treatment together. And this is not just for little boys or older girls, this is across the lifespan. There's plenty of evidence for that out there. What does that mean? People talk about multimodal, psychosocial, you know, what is that? It means that we're combining everything. The first thing you have to do, I think, in any disorder is to find out what really it is. If you don't know what you're dealing with, then it's really very difficult to take the physician's advice, the psychologist's advice, the teacher's advice. It's really very difficult for the person to even know what they're judging, okay, if you don't have some sort of a yardstick. So it's really important, I think, in any disorder, in anything, to know what you're dealing with. Behavioral modification, strategies, lifestyle changes. Now, unfortunately, we're trying to really promote that in the family physician's office, they're more aware of ADHD because we don't have enough specialists. The waiting lists are long. There are tons of barriers to treatment. It's expensive to go to get testing for psychosocial, for psychoed, et cetera, So sometimes they think, oh, well, I don't have the background, I don't have the time. But really, what we're trying to tell them is that a piece of advice, 5 minutes with your patients, telling them one even simple strategy can make such a difference. Again, we talked about medication, psychotherapy, others, people are using mindfulness, yoga, not instead of, but kind of complementary too. We talked about the no magic cure. I wish there are lots of people who come and sell products and say, I can cure you, you know, and this will work, and you take 25 sessions and it's done. I wish I could say that, but we can improve things, but we can't absolutely wipe things out. So again, it's gathering all the evidence and making a clinical judgment. I know Dr. McIntosh has gone through all about ADHD and the comorbidities. I'll just remind people that the core symptoms are inattention, hyperactivity, impulsivity, but you don't have to have hyperactivity and impulsivity to have ADHD. You can just have the predominantly inattentive type, 6 out of 9 if you're under 17. Impulsivity, you can have mainly hyperactive impulsive type. I honestly tell you, it's incredibly rare, and when you see that, it's usually in the preschoolers, and once they get into grade 1, then you see them losing, forgetting, being distracted, not able to manage their time, belongings, etc. And again, we judge it on, is this occurring with more intensity and frequency than your average, okay? And how do we do that? Well, actually, the brain develops quite, it's well known that how the brain develops, that at certain ages, by the age of 4, often the majority of kids can do at least one task that's requested of them. Self-regulation has also started to really develop between ages of 3 and 4, and that's aided by self-talk. And, you know, at the end of the day, I often find myself talking to myself saying, okay, put this here, put that there. It's externalizing, it gives them support. And we kind of know when to modulate our indoor voice. But all those developmental stages are going through. So you should be able to have, you know, what's normal for a 5-year-old. So you can diagnose ADHD in children in preschool. However, I would leave that up to an expert in the area, to a developmental pediatrician, child and adolescent psychiatrist, because there's so many other developmental factors, environmental factors that you really need to rule in or out. What do we use? Well, if we don't have a test, what we use? We have all the questionnaires. I'm sure you're all familiar with the SNAPs. Dr. Duncan I'm just going to say that I am going to say that I'm going to do the questionnaires at the end, the questions at the end, just because I'll never get through my stuff. Yeah. I don't have the presentation on that there. Sorry. Yeah. Okay. Instead of said that, that's women and girls, the next talk. Okay. This is pills and skills, and then the women and girls talk is the next one after lunch.
We don't have anything.
No.
Just didn't know that.
Yeah, sorry. I just assumed people would know that. Okay, sorry, it was so late starting, so many people, so many questions. Okay, all right. But nobody has, I mean, I can get you some paper if you want to make some notes. No, okay. Anyway, so this is brand new, hot off the press. Last change made last night, that's why, okay. So anyway, all right, so we work all together. It's very important to read between the lines in the report cards, and I'll tell you why, because the teachers, as you'll know yourself, you have to try and be as positive as possible, and particularly some parents might get a little miffed if they're not. But, you know, you have to, Johnny can now focus in the third term better. You know, then when you're looking back and reading some of these old report cards over the years, particularly when they're teenagers and young adults, you can see that there's hints that may not have come out and said it, or she rushes through her work, or he's learning to put his hand up now, those kinds of things. So it's also very important to get the evidence and ask, well, what does the coach think? How is he in soccer or hockey? But never ask just about the games. Always ask about the practice, because the practices are much more boring, routine, the drills, the humdrum. So honestly, you might miss it with the game because they're all excited and they're ready to score the goal and et cetera, et cetera. Okay. Again, emphasizing that it's a team effort. The parents are very involved. Mom or dad has to be the case manager and sort of go between A, B, and C. Even though you're not in the same office, the psychologist could be one place, the school is obviously somewhere else. Maybe they're in family therapy. So it's really important that there's somebody managing it. Honestly, finding a therapeutic alliance with whoever you're working with is so important. You have to have that trust. Otherwise, how are you going to feel that they're listening to you? How can you not otherwise go ahead with anything they're saying? So the family doc is kind of the cornerstone of care in no matter what you're doing, whether it's a GI, whether it's whatever. They're referring you to the different specialists. They're getting the reports back. So that's a good place to start. And hopefully you do have good rapport. And even if they're not prepared to treat or diagnose, they can at least start gathering information and maybe using getting some of the snaps and other questionnaires. They're online. Also, there's a bigger one, Snap 90, which looks at anxiety, depression, everything under the kitchen sink. And the 26 looks at oppositional behaviors and the core symptoms of ADHD. So that's a good place to start, okay? And if they don't listen to your story, there's not one or two ADHD people who are like, my God, I'd be bored to tears if that were the case. Everybody has their story. They have some similar core differences and challenges and all of that. And then their impairments can be significant or not because they may be masking them. But honestly, each family, we have different intellectual levels, cultural levels, genders, etc. So it's very important to listen to the story, be a good detective, because you need to rule in and rule out things. And these will be essential to target and must be included. Okay, for example, there's no point in targeting when you're treating the child, putting your hand up before you ask a question if the child doesn't have that problem. Okay. However, if they're always coming home without their textbooks or their agendas, etc., then that would be a very good place to target for that particular person. So keep that in mind. Because sometimes people say to me, I don't know what I'm supposed to be looking for. And I've had some physicians tell them, particularly if they're going on meds, well, just wait till the side effects happen and then you know it's working. Wow. Okay, well, I won't even go there, but it's not appropriate. But sometimes the person is brought in by their family, but they're masking, you know, they've had a lot of on the surface success, the girls with high marks, they're bright, they're motivated, they're anxious to please, and they look as if they're doing fine, and the teachers will give you a 0 or a 1 or very few marks on this. But underneath that, they don't realize that when the person comes home in the evening time, they can be upset and frustrated because they've had to focus so hard during the day. They're spending 14 instead of 4 hours doing their homework. So even though they're getting the good marks, they can't get down, they're procrastinating, etc. Often only children as well, that because parents don't see that. They're so busy scaffolding with all the kids, but particularly with the only child, handing them this. Here you are on the way out the door. That's usually the panic time for people. Have you got this? You know, they have no concept of time. So everything might be going fine until the last 5-10 minutes. And then, oh, they have to rush back. They haven't got this. They haven't got that. And the parents have got so used to doing that. And that's been so used to going on for years that they don't notice. Sometimes I tell them, can you step back? And I'm trying to get oh no, she doesn't have that problem. Can you just step back? I know you're very caring. And try not doing that even for a day, particularly on a school day or at the weekend or both, and see what happens. Why do you need to do that? I said, keep doing it, but just maybe sometimes they need to know that. So they can, especially with the adults, they can have way more significant impairments, but they may not be checking off all the symptoms. And guess what? If they're ADHD, they'll tell you one thing in the story, and on the check mark, they'll put down just a little or not at all. And I'll say, oh, but when you were telling me about it, you've already told me you've lost 3 wallets in the last 2 months, and you're on your 3rd cell phone, and you've locked yourself out of the car 5 times, etc. So sometimes just giving them back their example. So always get an example from them when they check, and you give back an example, okay? Because otherwise you're not going to be on the same page. And then I'll actually quite say to them, well, you know what? They say, oh yeah, you're right, that is true. I said, right, so we're moving that over into the quite a bit or the very much, okay? With their permission, but or else they're so distracted while they're filling it in a rush at the last minute, they check the wrong columns. So, you know, we'll never be replaced by computers. Isn't that true? Because otherwise you'd feed all these things into the computer, would come out with some sort of diagnosis, and it may not match the individual that's sitting in front of you at all. So again, you can't survive without this. And I like to try and educate the whole family, because there's going to be maybe a disbeliever otherwise, or they think they're getting special treatment, and the community, the grandparents, whatever. It's really bad, because remember, we can have this multi-generational problem. So, and the other thing is you're ruling in and ruling out. Is this really the primary problem? Is it really anxiety? Is it depression, etc.? And I know that Dr. McIntosh has gone over all of that. But you can have both together, or you can have looking like anxiety or depression, but really what's happening is that the person is so overwhelmed, so demoralized. They come into the doctor's office and they say, I'm in such a panic. I'm panicking because my exams are coming up, and I've been up all night, and I'm panicking because I leave my keys behind. So it sounds like anxiety, and sometimes they may get diagnosed with that rather than with the underlying cause. I just want to show you that CADDAC, which is the sister, if you like, it's for physicians and other professionals, psychology, teaching, nursing, everybody. We have was on the board and spent the last 2 years, you never believe it, trying to pull a chart like this together, but it's harder to write less than more, that's for sure. And we have a medication chart, which is excellent. It's actually used around the world, giving the details about the medication, and some contraindications, but we all have been wanting to put this together. So psychologist Carol Galani in Toronto, myself, with some help from some other people, put this together, and we wanted it for our CADDAC conference. So telling you that there is hope, demystify the myths, because they come in with all sorts of stories about what the next door neighbor told them, and that can really be scary, and be sensitive to all of their differences. And it's always very important to give resources, handouts, because if you're just going blah, 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 and talking all about ADHD, they're going to lose their focus, and they're going to nod, but they're going to walk out the door. So I use visual things. I use brains, and I use all sorts of things like that to try and get the message across and keep their focus as well, because I would be the same, you know, if it's just blah, 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 it's really nice to see some pictures. So we have this on the CADDAC. I think it's available on the CADDAC website, but it's also giving the physicians some tools that they can now pick a few areas in comfort and discuss this with their families. Okay. So you've got ADHD, can be debilitating, but is that an excuse? I've heard some parents say, oh, well, poor little Johnny, you know, he's got ADHD. We can't really expect him to do this or to do that or to do the other. So I will say, well, I understand and empathize, but this is the real world. You know, whether you got diabetes or asthma or whatever it is, you still have to be able to function and optimize as your life as best as you can. So sometimes they've gone through the denial. It's not me, it's the teacher, it's Johnny's best friend who's always getting him into trouble. And then sometimes they're grieving about that because he's not they think the perfect child, or he's like some older brother they had and they don't get along with him. So, but accepting and coming to terms with it is certainly part of that whole healing process. And it's always important to give them hope. Because yes, I do see really successful people out there with ADHD. Catching it sooner rather than later, we can avoid a lot of the stresses down the road. So what can we do? I want to always emphasize that ADHD is a family affair. It's multi-generational, and all I'm saying here that ADHD is a highly heritable disorder and everybody should be screened. The cartoon says, mother arrives home with her briefcase after a long day at the office. She could be a judge, a lawyer, whatever. Oh my God, I forgot I had children. So I often say that about some of the kids. I say, oh, I'd be afraid that they forget their baby on the bus or something like that. I think there was an episode of Seinfeld years ago that actually they did forget the baby on the bus. But it's also important to think about the other children in the family, because sometimes the whole focus is just on that child. Walking on eggshells around them if they're very emotionally dysregulated and temper tantrums. And the other kids think they're getting away with murder, or they're not getting as much attention because the whole focus is going on the other child. So I think that's really important to keep that in mind. Plus, even though the other child may not be the same in temperament, they could also have ADHD, but presenting in a different manner. I've had that in many families as well. So when you see a child, you screen the family or think about it in the family. You may see some of that in front of you, the parent who can't sit still, they're interrupting, they're getting emotionally dysregulated with their child, et cetera, et cetera. So really and truly, there are screens that you can give them, and you can always mention to them if they wanted to talk to their family doctor to take an assessment further. Others are very upset about that. They don't have any problems, or they're very grateful because they think, oh yeah, I was just like little Johnny, and do you think that could be my issue? And they're having maybe some work-related problems or relationship-related problems. So when mothers have ADHD, it's even more significant than dads. Sorry, guys in the audience, I know you're all brilliant and great dads and partners, but often still, even in this day and age, no matter how functioning the job is that the parent has, they are off, the mom is often the one left making the appointments, taking the appointments, getting them to bed or out in the morning, etc. So they look like the bad guy, and often sometimes there's that love-hate relationship more with them. So this one just says, I don't know, can you guys read it? I won't read it for you if you can. Okay, that's fine. Sometimes I'm never sure how they come out. So you can see it's a whole family affair of impulsivity and high excitement. I don't care what treatment options you go for, but I really believe in the holistic approach. The whole person, it's not just the ADHD. And everybody will benefit from a balanced lifestyle, right? We all would. These kids are gone out the door without their breakfast, or they run out of time. If they're adults, they forget to make the grocery list, so they don't have anything in the house. Then they're, eating a whole load of junk food and quickly going into McDonald's maybe and having fries, and then their cholesterol's gone up and their weight's going up, and they're could be in a pretty unhealthy stage. And then they'll always tell you, oh no, I don't have time to fit the exercise in, because they've spent too much time on the video games and they don't know how to prioritize. Also, some of them are engaged in risky behaviors. They're speeding. I even had a girl, she'd come everywhere on the bike. She went through red lights on the bike. She must have been a danger to herself and everybody else. It's also very important to talk about sleep, because as you know, with ADHD, they have a circadian rhythm that's a little off from everybody else. They tend to want to go to sleep later and get up later, except for some of the exceptions. So, you know, and usually they can't turn their mind off. It's not that they're anxious, but they're thinking about a million things. Oh, something would really scare them because they've had a horror movie. Now they take it to the nth and they're coming into their parents' bedroom. And we have other kids who are literally thinking, oh, what am I supposed to do for tomorrow? Did I have that? You know, they're trying to remember things. And I always say, have a pad beside your bed, whether you're an adult or a kid. Just write it down, let it go. If it's a worry, write the worry down, squeeze it up, put it in a worry jar. You know, just sort of get rid of it, or it's written there. So tomorrow morning, it's interesting. Things aren't quite as important as what you have to call the parent back for, or as an adult, get up out of the bed to do the activity that was bothering you. It's really important to encourage their skills and recognize their strengths. Far too often they get caught up, well, Johnny did this, Mary did that, and then they're saying that in front of the children too. So try, especially as a professional, if they're in your office, just sort of bring up, well, what's Johnny good? What do you like to do? What, you know, so that they, oh, you're an artist, that's brilliant, and maybe get some of their work and have it displayed, etc. Again, they're not out to get you, hopefully most of them, but they can be really challenging because of the inattention, the emotion dysregulation, the impulsivity, whoops, shouldn't have done that, and often they're good kids, but they're in trouble. Now, what works for an ADHD child works also very well for everybody else, okay, in the family and in the school. Sometimes most teachers are great. Oh, does that work? That's great. But it's the odd teachers that I've been teaching for 30 years and I can't give any special dues. This has worked before. And then you try and convince them that no, actually the strategy that works for the ADHD child will be just easy for everybody else. So what kind of parenting styles are successful? Well, if you're bad parenting does not cause ADHD. However, chaotic, dysfunctional and negative type of parenting really causes much more difficulties because the child needs the structure. They don't have internal structure. So the external structure, even though they fight it, okay, oh, I hate that, it's boring, you know, we do the same old thing, they actually need it more than anybody else. Even on a Saturday, folks out there, or the summer holidays, I've had many parents say, oh, Dr. Farley, in September, October, I'm going to definitely take your advice next year. I didn't put Johnny in this or Mary in that or Sylvia in whatever. We just decided we'd have a free summer and do, you know, whatever. Well, it was the worst. They were bugging them all the time. When are we doing this? When are we that? When are we going to the park? They need to have an outline for the day. And then they can let go that kind of worry and choice. And don't give them too many choices, of course, either. About, oh, where would you like to go today? Oh, I'd like to go to Hawaii. No, you know, you keep it limited to the park and we're going to go after lunch. Okay. So so keep doing that. You're doing a good job. Okay. And now sometimes things have to change. So you may have to be flexible. And also, rights versus privileges are really important. Now, getting together and solving things can be very beneficial. So what do you think you should do next time? Or what happened, etc. And there's the Ross Green program that Heidi talked about yesterday. And that's very helpful for plan A, plan B, and you pick your battlegrounds and you let go some of the stuff that's not that important. And then you can negotiate but some of the middle things. But then there are some things that are absolutely essential that they don't have a choice about. I think she used the example running across the road in the traffic. And also parents who may be ADHD themselves, they're always doing things in a crisis, right? You know, once the temper tantrum, once the explosion is there, then they're trying to resolve the problem. They're not thinking ahead. He's done this before. What happens in the similar situation? What can I do to avoid them getting to that huge situation? It's much easier to deal with things, to prevent them rather than have to deal with negative things at the time. Sorry, my cartoon isn't very good, but I couldn't resist it. This one is literally, but this is the way I know where everything is. Does that kind of look familiar? Okay. Even with your ADHD colleagues, I swear to God, I know I've had them referred to me, and they've taken in pictures of their office. Very good workers, highly regarded by their team, but particularly the women, and then they have, it's chaos, just like what I'm looking like here, except a lot worse. Piles everywhere, files everywhere, and then they have to work longer and harder and take their work home or work at the weekend, et cetera, et cetera. So that's their filing method, and they get really, really upset if you move one little thing, because they say, oh, I knew where that was. You couldn't. It was covered by, oh, I saw the edge of it, or whatever it was, or the stones, or whatever they're collecting in the room. So that can cause a mountain, and the same can happen with, literally with partners and spouses, you know, move something in the, in the room, in the bedroom, that's strewn all over the floor. Yeah. So there's a lot of talk about executive function, which you know is really the business of the prefrontal area of the brain to kind of plan, organize, self-regulate, etc. And there's been a lot about that at this conference. Some of that, I always talk about the conductor of the brain, that, you know, there's our many centers, I'm not going to go into them all, tons, fMRIs, brain activity, volumes, different locations, sizes, etc. It's not, you just don't go and diagnose ADHD by getting fMRIs and MRIs. It's still history and story, but the researchers have plenty of backup now, and the psychologists with executive functions and things like that. However, that's kind of the area of the brain. So what happens is that you as parents, or you as a partner or a spouse, are out there acting like their frontal lobe. Okay, because you're handing them stuff. Have you paid the bills? Don't forget the appointment is at such and such. Here's your lunch, you know, so you're there scaffolding and acting like the frontal lobe. I'm not saying don't do it, but sometimes it becomes so much part of the day that people don't notice it. What about medication? Certainly it can be extremely effective. There are tons of studies, thousands of studies out there looking at that. But does it resolve all the problems? No. So I think it's important that it's not a cure-all for everything. It's really important that everything is taken in combination. So now I just want to go back again to the CADDAC guidelines, the new sheet. We have the psychosocial sheet, and on the back of that, we have things to do at home. Some of you are probably doing them. Things to do at school, at work, and there's links as well, and how it can affect and impact relationships. So again, we're making sure that the docs have this, the primary care people, because you know, the psychologists and everything are doing that all the time, but want to make sure that they can give one or two tips in conjunction with following these children. So I think that's a very useful tool. And we talked about the structure and routine, but you need to set the goals and make them very clear. There's no point in going blah, 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 and I want you to do this, and I want you to do that. So it's really important to give just one or two step instructions. I like to have them posted in visible places and not too much clutter. I'm sure you've seen totallyadhd.com with the two comedians, and it starts off with, there's a whole wall and it's all covered with posties. Everything's important. You know, they can't prioritize what's important. That's another thing. What's a problem with ADHD. It's hard for them to narrow down and prioritize what's important. Okay. And they also procrastinate. Oh yeah, well, they have a list of things to do, but they check off all the little things, but the big important thing doesn't get done, and then they're in a panic and they're staying up and they're frustrated and etc. I find that using different colored folders, I've told the kids to do this just in their backpacks, so that particularly in junior high, middle school, high school, where there's several teachers, have maybe a red folder in the front and a blue one at the back, whatever you want, so that the papers or the handouts, I know they're getting less and less now, there's a lot online, but they can shove in stuff in one area to take home, so they don't have to be putting it in binders, and they'll never do that. They'll just shove it in any old where it gets crumpled and they can't find it. But if they had a folder just to shove it in, and then when they get home, that's checked by the family. Okay, let's open the backpack. What do you need signed? What? And then there's the other color folder, things to go back in, the homework completed, the signed letter, and then maybe that will dawn on them when other kids are handing in something to do that. Oh, of course, bedtime routines. I mean, how many morning routines are one thing? The whole family are late. They may be even losing their job. But honestly, the bedtime routine, the kids are masters at procrastination. Oh, I'm hungry. I need this. I need that, Mom. I want to tell you about my day. So you have to get wise to all of this. It's lovely they want to tell you about their day, but you can schedule all those things in and the snack and everything before the time and make it as matter of fact and routine with a positive incentive. Maybe you read them the story, whatever it is. No electronics in the bedroom. Not the only person saying that. It is detrimental. The girls are literally, what the girls are doing, they are texting people and they're like little social workers solving everybody's problem. And they're keeping them awake and panicking at night under the clothes. And then the boys are up playing the video games. So we know that it definitely interferes with sleep, and the adults, the same thing. So they need to be taken away, put in I suggest a lock-up area, because then what they do is they think about it all night. Oh, how will I get back down to grab that? Okay. When mom and dad are asleep, 2 o'clock in the morning, then they're playing on their devices. So, and I always say, you can blame me. Farrelly rules. You're not allowed to do this. Okay. And the kids there, see, Farrelly, so don't get mad with your parents, because remember, this is my rule. Again, just to give you some examples of keeping things simple and prominent. And I know this sounds very peculiar. Never shout instructions across the room. You would be surprised how many parents, when I actually ask that question, and I say to them, do you actually go up and get physical contact or eye contact with your child? Or, you're busy in the kitchen and you yell across, supper's on the table, or come for breakfast, or whatever. And they're engrossed in whatever they're doing, because once they get focused on something, they're more over-focused than anybody else. And transitions are really tough once they've got dug into it. So you have to keep that in mind. And they said, oh, well, yeah, but I told them, I warned, did you give them a 10? Well, yeah, I told them it was 10 minutes. And I said, but they're nodding, but they're not with you. Okay. And then you get mad and you pull the plug on whatever the TV program is or whatever the, computer is. And then there's a blow up. Yeah. It's mad, because I said, well, how would you like it if somebody came over and you were in the middle of this great detective show and it was 5 minutes to go to whodunit or whatever it was, and you were really enjoying it, and somebody came over because you couldn't hear them or missed what your husband was and yanked it out. How would you feel about that? Yeah, feel pretty mad. Okay. And so then we have to bring it down, and there's no supper, and the whole thing. So just keeping those kinds of simple things in mind, that it works. Make sure they've heard you. Yes, not, repeat it. I find repeating back, because I do that in the office sometimes. I can see them playing with their games. I don't mind if they're fidgeting with things, but when I say, so what did I just say? Oh, they got the last bit, but they didn't really get the whole meaning of it. So, so parents sometimes, don't get that. So again, as we've talked about, it's very good to set a timer, because they'll argue with you. No, it's not 10 minutes. There's something wrong with the clock, right? Okay. So when it's something exciting for them, they think time has gone too short. When it's something that is boring and whatever, it's like, oh, it's so long. Do I have to do this? How long more will we be? This is whatever. So they have that poor concept of time. They know the time, but they have the poor. So externalizing it like that really helps, because it takes away that nagging kind of voice. And then there's 5 minutes, and then there's an expectation. When you do that, then you get it to more of the same length of time. What about adults? They're often in crisis with paying bills, or there's one designated person in the family. Often the spouse is more organized, but if they're living on their own, I've met financial planners and organizers. We're good at the big picture, but the day-to-day bills, they're getting cut off, and their speeding tickets are mounting up, and the whole thing. So some of that day-to-day more boring stuff is hard to do. And you need to model that for your children and say, do you think mom and dad really like to sit and do these chores, sweep the floor, clean the sink, do whatever? No, we'd much prefer to be reading a book or talking to our friends. But when we get it done, we can do all these kinds of things. Where do you do homework? And I don't mean just for children, adults as well. Where do they sit down to do the things they have to do, catch up with the job, etc. It's really the best place that's suited to them. Usually I find that offices, their rooms are the worst place. Too many distracting things and not getting things done. They're better off maybe at the dining room table or the kitchen table, where you can kind of keep an eye, and maybe there's music on in the background. That kind of white noise is really helpful. The odd person, it irritates them, but in general, it's really helpful. So, again, we've talked about all of that. And again, at nighttime, I think music can be extremely helpful as well. So they talk about, oh yeah, I got my calendar, but you need to have that, I find, month at a glance thing, because they don't realize that, oh, they've got 3 weeks to do something, but really, have you got, 6 or 10 days at the most, because you've got all these soccer practices, you're in swimming competition, you're going away with granny for the weekend. So they need to learn how to start things, break them down. The teachers can help with that. The parents can help with that. And always, we try to use the carrot, okay? I love Barbara Coloroso, which says, catch them being good. So many people forget about that because they're so happy their kids are quiet and playing nicely that they're kind of tippy-toeing around, oh, how long will this last? This is great, and then all hell breaks loose, and then they're getting the attention from the parents. So sometimes just saying, oh, I like how you're playing. That's a really nice job. Giving them that attention can be really beneficial. And using the empathy statement, saying, well, I understand that you don't want to put your computer away and do homework. I usually say try not to do computer stuff, fun things like that before homework, maybe a TV program or out running or playing with a friend. It's much easier because it's very hard for them to break off in the middle of a game. Oh, just I need, and an adult's like that too. And then we have flare-ups. So I would save that for after the chore is completed. Then you may use your electronics, okay? But I understand you're mad because homework is tough, but that's kind of life. Again, giving the examples. Now, parents think they're doing this. I asked them how many times, well, oh yeah, we always use that, doctor. I said, really? Well, when you were in the office, I saw you said, if you don't do that, Johnny, you're not going for the lunch after Dr. Farley's. Okay, so they're using a threat. It's the same idea. They were promised a lunch, a nice lunch if they behaved in the office or whatever. But truly, if I had somebody speak to me like that, I don't think I'd want to carry on with it. I think, oh, well, I'll show you. I don't care about the stupid lunch, So it's literally, who wants to pick up toys? But when you pick you want to watch that cartoon? Absolutely. When you pick your toys up? Great. When you get the bills paid? Yes, you can go to the movies. It's an adult, whatever. So in the professional's office, do not leave without some sort of summary, etc. Okay? It's really important that you give written handouts. When I started way back in practice, way back in the dark ages, as a really young physician in this area, I realized that I gave them all the information and everything. My goodness, the number of phone calls back to the office. What was that she said? What are we supposed to do? Da-da-da. And I realized, okay, very soon, I wrote a plan. I had the plan and I photocopied it for them. And I do that to this day because that way I know what I'm going to be on the same page with them when they come back. Now, it can be multi-generational, so even though you make the appointment, they may forget. So I usually try and get them to put it into their app in the office if we have the appointment, and get reminders. So ask for reminders from the office, maybe depending on how many reminders you need, so that they will make it to the right appointment on the right day with the right child, because sometimes that happens too, okay? And I also I try to explain to them, I want my snaps back, or I really like to see the next upcoming report card. And the reason for that is I said, that's like my lab test. It's like blood work. It shows me which direction you're going in, because the comments can be so useful from the teachers. Really love them. It's great they fill in the forms, but the comments tell me tons about what's going on with the child. So I always circle that one. Yeah, so sometimes things are going really great with the kid. They may be on meds or not, or the skill was working well. So now nothing's working. They're miserable, the family, things are back to the old way. It didn't work, it's not working, doctor. Well, think what's changed in the environment. Sometimes I find that the mom who was home scaffolding the child all day has now had to return to work, particularly in Calgary, let me tell you, with all the downturn in the economy. We've had lots of moms having to get out to work, and some of the dads, God love them, in their bigger jobs are actually laid off. They've had no skills, and they may possibly be ADHD themselves or have no skills about how to get the kids out. Now we've changed all of those dynamics so we can have lots of things going wrong in the morning, the evening, etc. Maybe they're being bullied. Maybe they're not feeling well, or other emergence. Maybe they're developing, looking like they have more of a learning disability, anxiety, depression, etc. So keep those in mind. Well, we talked about sleep hygiene and how important that is. And I will just say that preparing the night before is one of the most simple things that parents, some of them do it, but lots of them don't. Well, no, they're in a panic in the morning, the whole family. It's much easier if after supper they have scheduled time to take out the backpack and after the homework's done, etc., put it right back in the backpack, the signed things, the gym strips, whatever it is, the library book, leave it by the door. So that's one less thing they have to worry about. If it's winter and we need boots and coats and all sorts of other things, soccer things, leave all of those by the front door. So that way in the morning, you're freer to not have to worry about those things. And then you can just deal with the normal reminders 55 times to get their socks on and they're playing with the dog or whatever. And parents get really annoyed about that. Doctor, I've been telling him for 5 years the same old thing. And his brother who's 6 can do it and he's 11. And I say, okay. Wrong attitude. Get up in the morning saying to yourself, yeah, okay, I know I've been doing this for years. However, I'm not going to take a calm tone of voice. I'm just going to say, have my list up. I like the visuals, maybe the toothbrush, the whatever. Get them to cut it out, make it a family thing, not a whole little type load of 10 things they're supposed to do. So you can have them go check. Yeah, what do you need to do now? Oh, excellent, And then when you have all of those things done and breakfast and everything ready, then if there's time left over, you could watch a cartoon or read your book or whatever it is. And that giving them an incentive. Having the TV on while they're doing all those things is not a good idea. Okay? But it keeps them from arguing in breakfast. Well, yeah, but they're never going to eat their breakfast or get on. Talking about pills and not giving skills, but they still can absolutely improve the focus. They can decrease the impulsivity and the hyperactivity. They can, in turn, decrease aggression and oppositionality. So that really, the combination can be excellent. So when the physician is bringing up medication, I know it's a scary thing. Gee, I'm going to put my kid on medication. You're not putting him on. You don't have to make a decision he's going on for life. You're just doing a trial. Does it work? Do the benefits outweigh the negatives, etc.? And make sure that you get all the information. You can go away and think about it, read your literature, come back, or you set up an appointment where you discuss everything. Annick Vincent, I'm sure you've seen this book, has a book out, My Brain Needs Glasses, and I've been using the analogy of glasses for way before, many, many years, because it struck me myself that before I got glasses, my parents didn't have glasses. I think that one aunt had glasses and a huge Irish family on each side. I grew up in Ireland. My dad was a doc in a small town, very busy. But honestly, in school, I would, was motivated by taking them down, and the nuns, of course, would say, well, you put down an 8 instead of a 3, or some of my friends would say, did you see? And I think, oh, I just must have missed it. So it's like ADHD. You don't know you have it because you've lived like that all your life, or at least with the myopia, short-sightedness, that started to come on gradually. Often it starts coming gradually kind of in the teen years. So nobody really noticed except for when I changed schools, and I learned the piano up close from the age of 4 or 5. When I started to learn the cello, that was a different thing. I was like this, and the different teachers said to me, what's wrong with your eyes? And I said, oh, nothing. I didn't think there was. She said, oh, yes, there is. I'm getting you tested. Sure enough, I was actually quite short-sighted. I was compensating, walking up in the back of the class, taking not even, paying attention to that. It's often the same with ADHD. You've lived with your impairment for so long, you kind of just think that everybody else is like that. So having that analogy of glasses when you're treating, it's that you shouldn't change the personality in a patient, because always people are afraid, oh, well, I like Johnny and his spark. They should not change. It should be able to bring out the strengths, and it should not make them more moody or irritable or not be able to eat or anything like that. So it's very, very important that you think that this is just, when I have my glasses on, I can see all of you. If I take them down, I'm absolutely in a fuzz, okay? No matter how much I try to train my eyes, that's not going to happen. So how does it work? We have the neurotransmitters dopamine and noradrenaline are the ones that are implicated in ADHD. So the meds work, the stimulants work, the psychostimulants work by the Ritalin family, methylphenidate, and the amphetamine family, the dexedrine family work by, not sure how to point this here, but if you can see there that there's a little, it's the synapse, it's called the synapse, but it's really the gap between the two neurons, where the neurotransmitters are inside. What they need to do is get across the gap, attach themselves to the little receptors, so they send an impulse on to the next receptor and so on, like a little electrical chemical impulse saying, wake up brain, you're not supposed to be doing this over here. This is what you're supposed to be doing when the teacher's telling you the story, not looking at what Gertrude was doing in the corner, whatever. So what happens then is you can see there's a little revolving, it looks like a little revolving door there, and that is the transporter. And what happens there is how the meds work. The stimulants work by blocking the reuptake of the neurotransmitters back into the cell until they've had a chance to do their job and attach, and then they can go back in. The amphetamine family, the methylphenidate family does that mainly. The amphetamine family also, but the amphetamine family also helps with the release into the cell. The non-stimulants work on the noradrenaline only at this level. I don't want you to worry about too much about that, but there's a lot of research, a lot of knowledge in this area. And that takes place mainly in the frontal area of the brain. So you're not giving a kid a medication or an adult to calm them down. That is not what you're doing. You're actually activating the area of the brain, the prefrontal responsible, so they can function better. And I want to say that medication does not control your child. And if you're telling a teenager about this, they would be very reluctant to think their parents now had more control over them. So what you're telling them is, this gives you more control over your life. Because now, instead of rushing in to do something and being in trouble and often lying about, oh, no, I didn't do that. And the wrappers, of course, of the candy are right beside them. They don't make very good thieves and because they don't have the follow through. It's all impulsiveness. Or the aggressive emotional dysregulation, and they shouted at somebody, but they didn't really mean to, but they've done it already. So, or they blurted out in class, and the teacher again has told them to put their hand up. And I had a teacher, I love this because the other day, one of the kids said to me, oh, you mean what Mr. So-and-so calls blurty-outy-itis. And I said, oh, I love that. I'm going to write that one down, and I'll use it. Compliments to the teacher, okay? But I thought it was a cute thing that he recognizes. And the ADHD children, adults, having a conversation, not only are they interrupting each other, but they're talking over each other, and they somehow or other maybe can resonate, or maybe not. Anyway, this is the CADDAC companion medication sheet, okay? And that shows you all the different medications. We have the first ones listed here are the amphetamines, the dexedrine family. And the second ones are the methylphenidate, the Ritalin family. I just want you to note that these medications, even though they are new, they actually have been around for almost close to 70 years. The old dexedrine, amphetamines, and then the Ritalin soon after that from the 60s. So it's not new medication, but it's new, it's newly, gosh, I'm having a moment of whatever. Pardon? Thank you. Absolutely. I say that every day, you know. Okay. It is a new delivery system which has really transformed treatment for ADHD. Because you can imagine, even though the Ritalin worked for some, there were more side effects because it was on and off. You couldn't titrate it as minutely. And imagine if you're ADHD trying to take short-acting medication 3, 4, 5 times a day, which had happened when you were older, because now you were at college or you were at work and you still needed to take it another few times into the evening. And that bang on and off. It's like telling me, okay, glasses, you need to take your glasses off at 4 o'clock and you need to struggle for the rest of the evening. Because sometimes they didn't have an evening dosage, or they forgot that because mommy's at work, and they'd phone them home and say, don't forget to take your medication. And of course they get sidetracked and never remember to take it. So now all I will say is long-acting medication is the way to go. If you're prescribing it, if you're taking it. Because, let's face it, take it in the morning and hopefully you don't have to, and it's a much more smooth, as a result tends to be less side effects. So they just have all different delivery systems. I'd be here all day if I took them all out. And which ones to start with? Well, all those long-acting medications are good. It could be a family preference. Maybe there's somebody in the family who's already on Concerta and you feel comfortable with it, they're doing well, that might be one to try. Maybe there's a next-door neighbor who's on Vyvanse and doing really well, change kid, he's, much more civilized with your son or whatever's happening. He can do better at the hockey, and then you're impressed with that. So you thought, okay, this boy hasn't turned into a monster. He seems actually to be less aggressive, etc. So maybe we'll start with that one. So the first line medications are the stimulants. We have second line medication here as well. Let me get this. So that just talks about the different releases, and some are a little bit longer than others, and some may. It's like anything else. Do you start with Advil? Do you start with Tylenol? One may work well for one person and their headache, but somebody else gets all the side effects in the books, and you try the other one. So just some guidelines for trials, because people still they come out with some myths about that. I hear people saying, well, he's a big guy, so he should be started on, this kind of 40 or 50 dosages of Vyvanse, or 54 of Concerta, why would you start with 18? Those kinds of things. But honestly, children have much higher metabolisms than adults. They're often on much higher dosages. And some more severe kids seem to be on higher dosage than others. I have some kids at 9 who are on 3 times or more the dosage that I might have a 30-year-old on. Big rugby player, 200 and something solid muscle, maybe doing fine, and 18 milligrams of Concerta, and I may have a 9-year-old boy who's way above the limits on that, but he's got no side effects. This is what's working for him, plus the strategies, plus everything. So you have to take in benefits versus negatives. But I think there's a myth out there, and that's what we're trying to train to primary care people, that starting slow, okay, and increasing gradually is the best way to go. I, over the years, way before CADDAC and everything, always wrote out my own, because again, they're going to forget. Even though I give them a plan, I give them and I put it in different colors, because that way easier for me to grab, but also for them in their piles of papers to maybe say, oh yeah, there's the Adderall, there's the Concerta, there's whatever. So I kind of give them that step by step. I try and equivalate. It's not, accurate, but the main thing is, what dosage is best? How many hours does it last? Because if it's only lasting till 1 o'clock in the afternoon, then either you need to rearrange the dosage, go higher, or you need to be switching to another medication that you may get a longer dosage out of, even though it's good for you. Do the benefits outweigh the negatives? Are there side effects? What are they? If they're very mild, the most side effects that you tend to get from the stimulants, which are the first line, as I said, tend to be a possible decrease in their appetite at lunchtime. But we say, well, make sure they have a good breakfast, lots of protein, whatever. And if they eat a little bit at lunch, that's fine. But they usually make up for that in the evening. So they're kind of maintaining their balance. However, I find that the lunchtime appetite, if it's the right med and everything else is good about it, and that's the only thing. Usually it returns after you've been on it for a while, or oh, so what? You have half a sandwich instead of a full one, but you're getting a better breakfast, you're getting a snack after school or finishing that, and often they'll have a snack before bed at night. So that wouldn't be, if it was a fact that they couldn't eat at all, or their dinner was a fact and they were losing weight even after they'd been on it, and it was a great medication for them, I say, okay, we've done all the manipulation. Let's try another med. Maybe you'll get the same benefits from another med without that. Same with sleep. People always blame the meds on sleep. And then when they're longer acting, they think, oh, it's going to be even worse. That is not the case. indeed. Once they've had a very good day and it goes into the evening time, they have a much better chance of a successful getting into bed. They can be more organized if the meds are still in their system. If they're not, they've had a better day, so they're less frustrated, they're less all these thoughts running around in their head, and they can follow through maybe with their sleep hygiene better. So that's a myth that a lot of physicians shy away from, thinking, oh, it's going to make them worse with the short act. No, the short acting, coming off with a bang and having to be without meds for several hours before you go to bed, you've been in trouble, you've got in trouble with the siblings, you won't do your homework, that can send you with give you a lot more sleep problems. Usually, it's no more than maybe half an hour, but they can still be in the room. They could be reading, no electronics, listening to music, whatever. So, if, of course, the sleep, some of the times the meds are great, but their sleep is so interfered with that they're up till 1 or 2 and they normally go to bed at 9 or 10 or sleep, then after a few days, you're not going to be able to focus anyway. You're going to be so tired. So what would be the point? The negatives are outweighing the benefits, so you would switch and try another one. And on and on. I won't, a lot more to get through, I just wanted to be sure that you kind of knew that, and you can ask your physician for the guidelines, look at the CADDAC, etc. And the great thing about the stimulants is you can stop and start just like that. They're not weight-based, as we talked about, but the others are, okay? But I would still go low and slow. I usually say maybe I'll start on a Saturday with the meds as well, because that way as a parent or as an adult, you have some control. You're not going to go to work and then feel horrible, or, wait for a week before, 3 or 4 days before maybe the teacher's phoning home and saying, look, there's something wrong with Johnny. He's too subdued, or he's way more wound up and hyper and running around. They're two signs of too much. So you cut down if it's too much. It's like the glasses. I go in, I have my diagnosis, but what happens? The ophthalmologist doesn't say, pick a pair of glasses on the way out the door there. He says, he tailors it to my needs. Is this better? Well, anything's better because I can at least read A on the chart now. But am I optimized? Am I at my best? Absolutely not. So what do I need to do? I need to go up until I find that I am normalized, okay? Not change my personality, but I have the same advantage as everybody else in life. I'm not cheating. They don't give me any extra powers. Wouldn't that be great? Okay. So keeping that in mind, then, you know the way if any of you have glasses, they'll go up a little higher sometimes, and then you go, I don't know, I think that's a bit too strong, or there's something about it that you don't feel right about it, and they go back down, and sometimes you feel like a bit of an idiot because you're going up, or maybe go back again, or could you know, and then you finally settle on what feels right for you. Okay, same with the medication. Just keep that analogy in mind. Okay, just a quick show that I've had this for years, but always struck me that the writing skills can improve, okay? And I'm sure you've seen that in classrooms. You've probably seen that in your children's, their agendas, the writing. Not for everybody, but a lot of them, because they stop rushing. They're focusing on what they're doing, not in a rush to get out in the playground or whatever. And they didn't have actual major fine motor difficulties. That's a different thing. But if it was just that messy, couldn't care, running, spelling all over the place, sloppiness, then, and sometimes parents tell me a year or so later, if they've been on the med, I think, he's the teacher sending home a few more notes and his writing isn't as good as it used to be. Sometimes that can help just with the guideline about what's happening with the meds as well. Well, you know that. Sorry, parents, that happens. You love them too much, you care for them, but that's what happens when they come home. Sometimes they've held it together all day with their friends and everybody, and then it's just come home and you say, I told you to put your bag over there, and it's like, the whole, I only said put your bag. But you've got to remember what's maybe happening there. And usually there's a trail of these children, right? In their wake, their backpacks here and their coats there, and there's half the sandwiches there and the crumbs are everywhere. So I call it a trail of whomever it is. And the door's left open, the fridge isn't shut properly, et cetera, et cetera. So that can cause explosions, but, it's just good to realize what's going on. So again, tip of the iceberg, I'm not going to go into it. Dr. McIntosh went on comorbidities. You can have the anxiety, depression, you can have LD, you can have anything, okay? But what happens with these coexisting or comorbid things is, even if we're not actually directly curing them, once you get the ADHD under control, it really helps, okay? when the ADHD is under control. Because now, if they have some anxiety, maybe it's anxiety traits, or maybe they have a full-blown anxiety, they can actually be able to focus long enough to listen to what the therapist is doing with them, the CBT or whatever. They can actually practice the homework, etc. So then that way you can improve. Or their anxiety comes right down because now they have control in their life. They're not in that panic. They are empowered, okay? Again, I'm coming back to that. I keep coming back to that no matter what you're doing, that we need consistency. And again, when we talk about emotional dysregulation, I know that's been talked about a lot, somehow step back a bit and remember it's not actually personal. It's not really directed at you. A lot of these are drama kings and queens, you know. They're so excited about something. Oh, it's great. And their voice is louder and the whole thing. And it's great to see them so excited, but maybe at a birthday party that mightn't work out, or people are beside them and they need them, and use your indoor voice, whatever. And they want something right away. Or they can make mountains out of molehills. So a little thing could be, oh, I'll never do that, I can't, it's this, I won't, you know, the whole thing. So remember that that's what we're looking at, is emotional dysregulation, hyper-reactivity, okay? Not just hyperactivity. And then we have the impulsivity on top of that. Relationships, absolutely, across the board, from the cradle to the grave, can cause problems. We've talked about that. Even being late for things. You have no respect for me, you're never late, you're losing your job. It's always really important to schedule a family time. I say, well, make a family meeting, have a pizza afterwards, do it like you were doing a movie, and everybody gets to say a little bit, okay? But have something positive. Because dad and mom may not be on the same page, etc. What's working, what isn't working, there's no point in continuing on with some checklist that nobody's interested in. And I always feel that you really need to negotiate. A lot in the election about building bridges, not walls. So I think I stole that from there, or the Pope. I'm not sure which. I think he said it too. But the rest, I've always said, sometimes with the divide and conquer, the teen, they're not getting along in the room, or the recently divorced couple, I say, okay, you're going to have your time, you're going to have your time, and I'm going to have you back in together. And then I know what they're all, and then I can negotiate a middle ground. So they get maybe a later curfew, when they do whatever else it is, etc. And sometimes I might be mad about something because they're not getting the Porsche version of the cell phone, because I've said, you know, that's not necessary, but you are getting to stay up later at night because I think at this age you should, you know, so we can do things like that. It's very important that people, the family members, model, okay, because actions speak louder than words. Okay, you can get mad with your kid for swearing, for doing whatever, but if you're doing it and you're telling them they're in trouble, then it doesn't make any sense. They'll say, oh, but dad, you did, and they'll be the first one to tell you that, or tell on dad in the doctor's office. He's yelling all the time, you know, so you won't get away with it. And it's always great to teach them calming techniques. First of all, start with a voice, because if they're up there and you're up here, you don't listen to each other. But you know, and you can't. So somebody has to step back. Some of these kids start learning to do that. Give them some cues, do a stop sign, do whatever it is. Others, they're so mad they can't do it. You need to step back. I'd say silence is golden. Step back. And if they won't stop, sometimes the ADHD person has to have the last word. They're ranting after you, but. So I said to the parent, well, go into your bedroom, whatever, lock the door, turn your music on, because, you know, they're just going to keep banging on the door and say, but I said, and it's not fair, and, you know, the whole thing. So if you got caught up in that, it's going to be an absolute nightmare. So sometimes letting it calm down. And these kids are often, they're good kids, you know, they're sorry, or they've lost the privilege or whatever, but they'll learn from that, and you can problem solve over that too. So I tell them to take deep breaths. I show them in the office. I show them a thermometer. Have I got that? Okay. First of all, to get to that, I help them recognize their cues, because sometimes they don't realize when they're getting red in the face and their hands clenched or their stomach's in a knot that they're mad or they're sad or they're anxious. So trying to tie that into the brain and what's happening can make a big difference. And then I'll just go back. We talked about getting away. Sometimes the adults can know that. Walking, getting active, exercise is wonderful. Not only does it help with frustration, but it helps with, I think, regain your focus. There's a lot of studies out there using exercise now. It's not confirmed that it actually treats the core symptoms of ADHD, but how can it not help? Okay. There'll be a meta-analysis looking at all these studies. Some say yes, but really whatever you're doing is you're burning up energy, you're getting rid of your frustration, increasing the endorphins, and that has to improve. Once you get rid of that anger, has to improve your focus. So I try and get them to do that on a regular basis anyway. And we talked about the emotions. And also I want to say about the emotions of physicians in the audience, that really saves a lot of unnecessary tests. People coming in with stomach aches and headaches and being over-investigated when all it was is, usually if it's Sunday night for school, then they're worried about their assignments, they haven't got it done, there may be not a goodness of fit in the classroom with kids or with teachers or whatever it is, or they're just not getting the strategies they need, or, you know, all of those things going on. And then they kind of relax at the weekend, and then the same with holidays. This is the biggest trigger going, right? We talked about that. Okay, so again, we talked about setting the guidelines. I draw a little thermometer picture and I say, so recognize when you're, you know, when do you start to get mad? Is your face getting red or whatever? Start recognizing that and rate how you're feeling, or, you know, they're not going to sit down and rate it, but at least the parents can see, uh-oh, we're getting into trouble. So again, you don't wait for the 2-year-old to run out in the road. You see they're going to do that, but you distract them. Hopefully you grab their hand and say, oh, look at the birdie over here, or something like that. So if you can sort of do those kinds of things, intervene before we get to the volcano and it's erupt. And also, parents have a hard time nowadays because their teens in particular are always saying, well, Johnny has the latest cell phone. He's got the iPhone, SS and Plus, and so-and-so's got Dolce & Gabbana glasses or such and such shoes, and, you know, get over the top, and they're probably listening to the Kardashians or God knows whomever. So they have to realize that this is the real world. Money doesn't go on trees. We are here to provide you with the basics of love, and you get them, your fresh jeans and your good shoes and all of that. However, if you want to go overboard and go to the higher level, then we're perfectly willing to put out the money for the basics. And if you want the higher end, then you start to save, and we'll do that. And it's a very good teaching experience. And then they suddenly realize how important is that, and what would they like to do with their money instead. So you're not saying no, again, you're negotiating. And, you know, when they get their homework done, maybe they can earn an extra point, or you can do it a lot of ways. With the emotional dysregulation, how many times do you hear families saying this? It's really quite sad. Oh no, we don't go anywhere, doctor. We can't take him to a restaurant. We can't go to the grandparents because all the cousins, you know, don't want him around because he's grabbing all their toys. And so really and truly, if they have some of those skills and they prepare the other families and they set up things so it's not terribly exciting and they're not too tired and staying up too late out of their routine, this really can be helpful. So what are some of the barriers to treatment? Well, I think people sometimes can give up too quickly. I just feel we're in it for the long term. This is a lifespan experience, okay? And old habits die hard, you know, finding them back to yelling again. It's really hard, but honestly, start with small successes, build on those. And then you think, oh, I can do this. And I'm keeping consistent. And one of the worst things parents tell me is, they say, mornings are, I've seen them 6 months before that or 4 months and come back, oh, it's expecting things to be even better. Oh, it's awful. The morning routine is horrible again, that that. And I said, whoa. And I would read out my notes. Remember the last time this was happening? They were privileged, their cartoons. You were all getting to work in time. And you had a nice visual and you said you were giving them a check mark. And, oh yeah, but we stopped using that. And I say, why? Well, he was doing it all. It was working, you know? So sometimes you need to keep going with whatever's working and transfer that. If the teacher knows in the classroom what works for Johnny, she can tell the parents, I found that this really helps. You know, if I do this, if I put my arm on his shoulder, if I do whatever, and then the parent can use that, and vice versa at home, what working, particularly for a new teacher, it's good to know what the older teacher, not older, but the previous teacher was using, what strategies worked, know all about the child as well. Again, I can't stress this enough to try and keep it positive. And then, you know, it's not all going to be the same. As I said, in preschool, maybe just getting them to put their toys away. Maybe the child could stay seated at dinner during the family time. Adults get their bills paid, etc. What do you say? People say, well, what do I say? Just normal things. It's a great job. Good. I'm proud of you. It doesn't have to be all material. It doesn't have to be all money. It doesn't have to be all electronic time. They could play with a friend. Oh, yes, you may go play with so-and-so. We'll go to the park. Dad's home this evening. I know you like to play chess or whatever it is. We can do that. And then these are privileges again. Keys to the car. It's not a right of every teenager to have a car and have the keys to it. Actually, sometimes you'd really be terrified to think that they're behind the car, and absolutely with no friends in the beginning, because that distractibility can be horrendous. And there are lots of studies out there showing that they do perform much better on meds than off meds when they're actually driving. And the other thing is that the accident risk also comes down with medication treatment. Lots of studies showing that. And the mortality rate, I don't want to get into all these horrible things, but it's true, because there's this big study out of Sweden, and I'll mention that a little this afternoon, that shows that the older you're diagnosed, the more chance you have of premature mortality, not just accidents, but accidents are the main cause, and women even more than men. I'll just throw that one out there. So adults need to actually know how to reward themselves as well. And they should model that and say, because mommy has done this and that, now mommy is going to call her friend or watch her favorite TV program, etc. Speak out loud. What do you gain? You don't have to redo assignments. You may actually have more free time now because you don't have to backtrack everywhere and try and find things. And the boss is happy, etc. So they're the natural consequences of what you're doing. What about divorced parents? Sometimes that can be a nightmare if they're not getting along. In particular, they won't talk to each other, or they just curtly email if we're lucky, and they can't be in the same office together at the same time. Others they're great. They're there for the interest of the child. They can be together. They can work together. So sometimes I have to separate the appointments because it doesn't work very well to have them arguing with each other in the room, particularly with the child there. So, but that can be a problem, particularly if one of the parents has ADHD. They don't check. They just send them back to the other parent. And their homework is left there, their favorite toys, their the whole thing. So making a list for each home and having double sets, I think, is really good. And in actual fact, for school, later on, for some of the kids who forget to bring the right books home and everything, having a double set can be very helpful too. So what other accommodations? Very important early on in the school year when you have the diagnosis to meet with the teachers. I think they meet with you usually in September, and even before that, because don't take for granted that they have had a chance to read the file, that the file was even transferred to them from another school or brought to their attention. And so it's very important that you sit down and maybe highlight some of the deficits and some of the strengths and what strategies have worked. And that's really great. And set up communication. So either you email each other once a week, or they let you know when things are not handed in, etc., or even heads up about what's going to be coming, so you can be proactive. There is a physician's letter that can be sent to the schools, and it's on the CADDAC website. So doctors hate writing letters. Could you please write a letter for her? You have to sit and think in the whole essay form. But if you got a check mark, then they could at least check off what's relevant for you. They can photocopy it in their chart. They can take it with them back to the school, to the post-secondary, wherever it is. CADDAC have excellent websites, as you're aware, as well. And I also work at the Can Learn Society. It sounds like a cult, but they changed it from Calgary Learning Centre because of non-profit naming or something. So I always say that. But they are excellent. It's an attention clinic, multidisciplinary, very ethical non-profit. So they have some excellent series, particularly for teachers, but also for parents. And this series is telling it just takes 10 minutes to do this. Just 10 minutes. So that the teacher knows she only has 10 minutes that she has to look at a particular segment. Okay? Also, before I forget, I do have some, I left some yesterday, I don't know if they're handed out, these ADHD families. This also comes from Calgary, but it is universal, so it's approved by the Children's and work together with CanLearn. And what they do is they have lots of valuable information that's all evidence-based, because, you know, there's a plethora of stuff out there that's absolutely not relevant. What about those people transitioning to post-secondary? They often get lost. Either it's the first time they're being diagnosed, or God forbid, they've gone away for their undergraduate out to some other city. And there they are without the scaffolding of the parents, falling apart, forgetting to make their appointments, see the doc. If they've meds, they forget to renew them or take them. If they don't have meds and they're not diagnosed, they often fail a year, etc. So make sure that you warn them to connect with the student health at the minute they get there. Half them forget, and then it's full. But really put that into them. Employers, you can bring those letters to your employers saying you have the diagnosis. Don't expect, you know, huge, they'll back up, but just a few simple things. Maybe a meeting with the manager once a week or something to make sure you're on track. Tell them that, you know, deadlines, you need reminders, etc. Get it in writing. That can be very helpful as well. Also available on the CADDAC guidelines. These are some programs that you've heard of: Collaborative Problem Solving, The Explosive Child with Ross Green, Your Defiant Child, Russ Barkley, 1, 2, 3 Magic, that still works, especially for the younger kids. And Kids Are Worth It, Barbara Colarosa. I mean, there's whole things out there, but these are just more to kind of like to do with parenting. Some of the supports we talked about: CADDAC, the CanLearn, and there are European guidelines out there as well, but they actually use ours. Took a lot of the presentation from an article that was published in Europe just on the guidelines for psychosocial. So now I'm sure if you have any questions, I'll be happy to answer them. I'm not sure how we're doing with time, because you must be starving, and I have another talk to get because we got behind with the last talk. So maybe I'll take a few questions and let you get to lunch. Anybody have any? Yes?
Our son just started medication in September, and he's been consistently losing weight. At what time would we said, you know, we're concerned about this, he's lost 50% of his body mass. At what time should we say, okay?
So it's not just weight that you have to worry about. There are kids who come into my office and they have lost 10 kilos from the time they started on the meds. And the family are pleased. I'm happy because and I'll talk about this more in my next talk, they're not doing that mindless eating because they're bored and impulsive, sticking into the chip bag and eating the whole thing. And so I don't know about your son, but sometimes they're actually may have been a little on the overweight side. And now what happens is, if they're eating less, they may actually be eating their meals, and they may not be eating a lot of junk in between. Now, I don't know if that's the case in yours, but I'm putting that out there because sometimes there is a link with ADHD and obesity. And so I just wanted to clarify that would be one thing just to consider. But if it's not that, and the boy is losing a lot of weight, he's not eating lunch, he's hardly eating any dinner, then that would be, and it's continuing, because that might happen for the first month or two, but continuing at a rate that you're concerned about, then you'd have to say to yourself, is the medication working though? Is it helpful for him? Like, there are benefits outweighing the negatives apart from the appetite? And is he getting more work done? Is he better with his friends?
We've seen some.
Okay. So if the dosage is optimized, it's high enough, and too high, if you're higher, you could be more irritable, hyper, overfocused, moody, et cetera, but you're still concerned about that after how long did you say it was? September. Yeah, 3 months. Then, you could always talk about switching to another medication. And that's the beauty of stimulants. You can stop and start. It's like me with the glasses, new pair of glasses, go on. Okay, it's out of the system very quickly. We don't have to do monitoring with blood levels or anything like that. So you could talk to your doctor and say, look, we're concerned. I know he's doing better, but maybe he might do as well with another med and still have an appetite. Okay. Okay?
It has been common to advise breaks at weekends or during holidays from medication for ADHD treatment. Is that still standard?
No.
Because obviously
hasn't been standard.
The process goes on for a long time.
Yeah, has not been standard for so far back that I can hardly remember. But yeah, if you remember in the beginning, I say 24 hours, 7 days a week. Often the weekends can be the worst time because if they have significant social issues and they've got to get together for their hockey and relatives are coming over, et cetera, it can be an absolute nightmare for. So remember that this is, impairments are in more than one domain to make the diagnosis, okay? They could be worse in one domain, school versus home for some kids, or vice versa. Home versus school, where there's structure and respect and, the whole thing. So I do not tell people to take their medications off over the weekend. And for some kids, actually stopping and starting, they may have just got over their side effects and now you're stopping and starting again. That, particularly with the short acting, used to be a problem. And parents say, well, they're doing that. You may be going on a trip to the zoo. How much are you going to learn? You're going to learn. You learn outside of school. It's a whole playing field out there of learning. You have to negotiate your way with your peer group. That's really tough. Not the younger kids that you can boss around, not the older kids who make allowances for you, but your peer group. You're out on the soccer field with them. You're in the playground and you're bossing people around and you're not reading the social cues. So, no. They're always talking about worry about growth. I can tell you that there are many studies that over the years have also shown that there are no growth problems. If you follow them long enough, some of these studies are short, and especially if you look at them in teenagehood. How many people have looked at a grade 7 classroom or 8? You've got boys who look like they're 9, and you've got boys who look like they're 17. Poor things. 6 foot, bean poles, and it's horrible at either end because now they're expected to talk and walk like an adult, an adult when they're only 13, 12. So there's a huge spectrum of growth, and often genetics needs to be taken into consideration. I have families where I have a tall father or mother, and I have the kid that's now in grade 7 or 8, and they're smaller, they can't get into the bantam hockey, they can't, this sort of thing. And I'll say, so are you concerned? I know he's the shortest in his class or whatever. And they say, no, doc, we're not concerned. His dad was exactly the same. Always ask about the family. Or my brother was exactly the same. He didn't start growing until he was in his, almost 20. And I've seen kids and they're growing well into their 20s, 21, 22. And they're the ones that get the last laugh and they go back to the reunion and they were called shorty. And then now they're looking down at some of these people. I know there are anecdotal stories, but really, to be on the safe side, you can monitor their height and weight through your family doc's office, your pediatrician's office. If there are major concerns, obviously, you're going to talk about it. But those kids are at the end of each spectrum. There's your average, and then there's the people that are going to have more appetite, more sleep. For those kids that nothing works for them except one med, but it still have terrible appetite problems, and their weekends are not a disaster, maybe have a day off or another day, or pack them up with high-cal food, Pediasure and all of that. And as well, people talk about summer breaks. I don't say that because, again, you can have terrible problems over the summer. There's some kids who manage, but you can have terrible problems over the summer because they're going to be in camps and they're kicked out. If you're going to look at, if you really truly believe, I think they've done really well, or the teenager thinks, hey, doc, look at me, I'm getting A's, I'm doing really well, I'm on the team, I've this, I've that. I don't think I need my meds anymore. And that's fair, I'm sometimes skeptical, but I think it's fair to listen and negotiate, not say, fine, let's try you off your meds, but I want it for more of a defined time. I don't want it in September because the teachers don't know you, and so they're not going to be able to judge. And it could be a honeymoon period anyway. It's either a honeymoon period or disaster with the transition, one or the other for the ADHDs. So I said, maybe after October, maybe late October, when everybody's got to know you better, your skills, the whole thing, then you could stop your medication. But I want the rating scales before, and I want the rating scales when you're off your medication. And the appointment to come back and check in is such and such, and maybe after another month after that. However, you have my permission that if things go to hell in a basket in between time, or it's not working for you, then you go straight back on your medication. You don't have to ask my permission or call, etc. Here's the prescription, okay? You'd be surprised how many people come back, and I'm expecting, okay, so we're trying off meds. Oh, well, actually, I'm back on them, doc. Oh, okay. So how was it? And then they'll tell me either they didn't make the team, or their marks that were A's are now gone down, or going down, etc. That's not the case with everybody, but in general, I'm finding that. And then there are the kids who are very obvious. If they missed their med for 1 hour, the teacher's calling, or the parent can't get them out the door and they were getting out the door, or they come home in the evening and they're all over the place and they're this, and then one parent says to the other, did you give his meds this morning? Or they give the wrong dosage. They forgot to give the second dose along with that, or, whatever. So you have to step back and see. And if they're managing without it and all sometimes when people have actually know what it is like to focus. Remember these people like me with the glasses? I just thought everybody was seeing the same way as I am. They had no idea what you were talking about. Focusing and stopping and thinking and all that. But having been on the meds for a while, for some of those people, it's like light bulb went on. Wow. Oh, I can do this. Oh, I know what you're talking about. And some of them have not been on meds after that. Others I have followed lifelong. They're obviously the successful ones. And I'm saying that because they're still coming back with their own kids, and they've got married, they've had successful relationships, they've done well in their jobs, and they have continued on their meds, and they've grown and developed over the years as well. It's 12:30. That's wrong, right? It's 12:30? Okay, because I looked up and I saw 1:30 and I thought, okay, I didn't think it was that bad with time. So I'll give you a break for lunch and I'll gather my thoughts for the next one. You've been a great audience. Thank you very much.